started. Hi, everyone. Good afternoon. Welcome to session 11 of our San Joaquin Stanislaus Collaborative Planning and Implementation. Can't believe it's our second to last session of the year. I feel like time flew by. Next slide. So just a quick reminder, this meeting is recorded and it will be uploaded for you all to view at a later point. Next slide. Okay, so we'll go ahead and get started. Next slide. So just some quick housekeeping reminders that I'm sure you all are familiar with. If you could, please update your name on Zoom and include the name of your organization. For our chat icebreaker today, I thought it would be fun to ask you all what your favorite all-time TV show is, or your all-time favorite TV show. Maybe your comfort show or whichever one you always go to. I think that's always fun. And then, as always, we're looking forward to a dynamic session. Really encourage you all, if you can, to turn on your cameras and engage with us, either through using the hand raise function and unmuting or chat. Want to hear from you all of what your thoughts, feedback, questions are. So would appreciate that if you all are able to. We're getting any responses in the chat? The Office, and This Is Us. Law and Order, all of them. Love this. I feel like there's a lot of classics that I have not watched, so that will be on my list of things to do. Okay, great. So we'll let folks roll those in, and then we can go to the next slide. Okay, so if anyone is new and joining our CPI meeting for the first time, just want to give you all a big welcome. Feel free to also do a quick intro in the chat if you're new. Our CPI meetings are a space for us to gather and convene regional Medi-Cal transformation stakeholders for us to be able to collaborate, identify challenges, and problem solve with the goal of improving CalAIM implementation and driving utilization. So encourage you all to ask questions. This is an open space for us to learn from each other. And then we've also included the link to our project materials. I know there's often questions on where can we find the old slide decks. So you can find those and any resources we share in that folder. And we also just dropped the slide deck for today's meeting if you want to follow along. Next slide. Okay, so for our session objectives today, we hope by the end of the session, participants will receive updates from our MCPs, receive general CalAIM landscape updates, as well as hear from you all, your peers, on any events, activities, things that are happening that you want to uplift. We also have an exciting presentation from our San Joaquin Stanislaus 2-on-1 representative. So we will be learning and understanding the role of 2-on-1 and identifying opportunities to collaborate to help increase referrals, partnerships, and connections to beneficiaries. And then we'll also be sharing information on our 2025 CPI session dates and office hours, as well as flagging our in-person session. So definitely want to stay for that. Next slide. Okay, so for today's agenda, we're doing our welcome and level setting as usual, and then we'll move to updates and resource sharing. So we'll kick it off with some general updates. And then move on to regional spotlights. So encourage you all, if you have updates to share, would love to hear them. And then we'll also hear some updates from our MCPs. And then we'll move on to our San Joaquin Stanislaus 2-on-1 presentation. So we'll have a spotlight from them, as well as talk about opportunities to collaborate. And then we'll wrap up with some next steps and office hours, as well as introduce our an upcoming CalAIM 101 Learning Lab opportunity that I'll talk about later in the session. Next slide. Righty, so moving on to updates and resources. Since the last time we talked about cited in our previous session, just wanted to share that the state has released their round 4 priorities. So just want to uplift those for you all as you're planning, potentially planning to apply. So as you can see, there is an emphasis on rural counties. The state is also looking to address statewide ECM and community support service needs, as well as looking at county-specific gaps in ECM by populations of focus, as well as community support types, and counties that are providing transitional rent. So wanted to share that update. Next slide. And this is kind of our version of a high-level timeline of what to expect. I know we've been talking a lot about various activities with Cited, so just wanted to kind of map that out for everyone to kind of follow along in terms of support that we will be providing as a facilitator, as well as important deadlines that correspond with the application opening and closing. So next month, December 20th, we will be hosting a Cited Round 4 Learning Lab. And we've listed some of the topics that we're hoping to cover, but also encourage you all, if you have feedback on other things that are of importance, to send those to me via email as we plan for that. So definitely hold that time on your calendars. And then an important date, January 6th, is when the application will open. And from that time that the application is open and will close, we will be providing additional support through our CPI session and office hours. We are planning to have an in-person session in February, so we will be using that to reserve some time for us to address any last remaining questions. And you'll also have the opportunity to connect with your peers as well in case there are any other ideas that come up before the submission deadline, which is March 7th next year. And then on the side, we've just included a quick reminder about Cited for those that may have not heard as much about it. It is a funding opportunity that's intended to support organizations with building up their capacity and infrastructure for ECM and community supports. And we've listed some of the uses for Cited here, but we can definitely dive a little bit deeper into that during our learning lab. So this is just a quick high-level timeline of kind of what to expect and important dates to keep in mind. Next slide. And I will pass it on to Gretchen for this.
Great, thank you, Navneet. Hi, everybody. Hope you're having a good Monday. I know we've talked about the JI initiative and the CPI before. We've had some office hours, but just wanted to raise it up again so folks are tracking what's happening across the state. It's really exciting. So California is the first state in the nation to really launch this pre-release services initiative where folks can enroll in Medi-Cal and get a targeted set of services before they re-enter community. And the intent, of course, as you all know, is that we would have some continuity of care between what folks were getting when they were incarcerated and what they can get once they're in the community. And so really working on that. We have 3 counties that have gone live to various degrees with these services in the past 6 or 8 weeks. And more are coming. And we do know that San Joaquin Sheriff Department will be launching this live at the end of January, hopefully, if everything goes well. I know things are still being approved. So just wanted to raise it up again, let you know of some resources that could be helpful if you're trying to understand what this is, how it may impact your work as ECM or community supports providers. So we have a fact sheet that's linked here at the bottom that has a lot more details on what it covers, what's being offered, et cetera, et cetera. And then what I'm really excited about is the state has been doing these webinars over the past several months around the JI initiative, and they have very specific focuses that they've been looking at. And the most recent one that was in November was on ECM and the JI population of focus that has yet to be posted to the website, but I know the webinar will be there. But it was really, really helpful to think about how do we intersect our work as ECM lead care managers with what folks are getting in their pre-release services. So just wanted to raise that up. And then if you're curious about the going live dates for other parts of San Joaquin's corrections facilities or for Stanislaus, we do have a link we'll pop in the chat here that talks about the readiness timeline for these different programs. And again, if you work in multiple counties, you can also check that out to see when other counties will be going live with these services as well. It's messy, it's hard, but it's really exciting. And I just encourage everyone, if you are working with this population, which probably a lot of you are, even if you're not, contracted specifically for JI, you probably have folks that have been in the system who you're working with. There's a lot of great resources out there. Any questions? All right, I'll turn it back over to you, Navneet.
Great, thank you. Next slide. Okay, so this is our chance to hear from you all. If you have any updates or spotlights that you would like to share with us, this could include upcoming events, maybe past events, meetings, any recent successes that you think your peers would benefit from hearing about. This is your opportunity to brag about the amazing work that you all are doing, so would love to hear from you all. If there's anything you want to uplift. I know I got to participate in a really cool event this past Friday, which was hosted by the San Joaquin Community Health Leadership Council. They held their 24th annual community forum, and I know I saw some of our providers there in person, like community medical centers, Amelia Ann Adams, the Emergency Food Bank. I know I see some of you all on the meeting, so would love to hear if you had any reactions from the event or anything you wanted to share with us. Okay, I think it's a quiet group today. I know you all are doing great work, so we'll keep trying and find a way to uplift this work. I know Melissa also had a question in the chat if anybody's seeing successes in their delivery of services. So if anyone wants to take a stab at answering that question, I'd welcome that.
Hi, everyone. I'm Lisa Silva. I'm new to this group. I am a newly appointed regional manager replacing Susan Brown in this area, San Joaquin Stanislaus County. I'm just excited to be a part of this group here today. I think that we've been managed care provider in this area now only for a few months. So we are seeing some fast growth with making some connections. So I'm just really happy to be a part of this meeting today and introduce myself to everyone. And next meeting, I hope to share a success. Thanks so much, you guys.
Yeah, Navneet, I could also share. My name is Hannah with Little Manila Rising, and this past Saturday, we had our health and healing clinic that happens 2 times a year. So we partner with Kaiser Permanente and Community Medical Center each year to provide free physical health and mental health care education and services. We had physical therapy provided by UOP. We had massage therapy, free groceries, fresh food, haircuts. And then Kaiser, they typically give medical advice and blood pressure screenings as well. So was very excited to have at least 200 people come out in attendance to our event. So very excited and grateful that community members were able to come out and take advantage of the different services and learn more about the resources that other community-based organizations and health-oriented organizations provide here in Stockton and San Joaquin County. Thank you for letting us share.
Yeah, that's awesome. Thank you for sharing that. Anyone else?
I have a quick question because I hear that there's a couple of new people in the group and we are planning to host a CalAIM 101 next Monday, I believe, and we'll share the link for that. But just kind of curious if any of you can voice over what you would be most interested in hearing about so that we can really emphasize that during the session. If you're not able to attend, we will be recording. And so just want to make sure that we touch on some of those points. So we can also use some of this time to to hear about that. Roberta, I know you mentioned you're new, so if you don't mind voicing some of that over, and anybody else as well.
Hi, everybody. I don't mind at all. Please forgive me not being on camera. I'm not feeling too hot right now. So, but we are new, trying to implement the CalAIM, ECM, and CS services into our organization. We are interested in how we can get the most out of the resources that we would be able to offer to the participants enrolled, any resources for any housing, community resources and all of that. So we're just building our CalAIM program up right now. And so anything that would help us to deliver successful services to our participants to help with their healing, their progression would be awesome.
Thank you so much for sharing. Anthony, I saw you come off camera. I'm going to pick on you.
Oh, yes. Hello. Can you hear me?
Yeah.
Hello, my name is Anthony Urbano. I'm the director for CalAIM services for Westcare, California. I wasn't going to speak today, but I decided to just go ahead and introduce myself. I'm currently building our program in Stockton, California. I'm based in Fresno, but we do have capacity now. We have a ECM lead care manager, and we also have a community supports housing navigator. So we are we've just been doing a lot of initial stages of the program, getting the contracting going with HPSJ. So I just want to let everybody know that Westcare, California is now in San Joaquin County, based out of Stockton. And we're looking to connect with all community-based organizations. We're looking to solicit referrals and just, start interacting with the community.
Thank you so much, Anthony. And I'm going to do a plug for our provider registry. So I know a lot of you have heard about that, but we actually collect all of your lead care coordinators' information and share it with this group. We also have kind of a two-sided sheet that we've been sharing at community events and sharing with the public. And so, Anthony, if you're interested in being added to that, please send us your lead care manager's information and we'll put it on there.
Perfect. Thank you.
Navneet, I'll hand it back to you unless anyone else has any comments or questions.
I just have a question. How is there a link for that provider registry?
Yes, there is, and we'll drop it in the chat. Thank you so much, Navneet. And then we can also show you guys the PDF that we have, kind of the little mini directory that we've created that we share out during public events if you guys are interested.
Yeah, I can share that in my follow-up email as well. If there aren't any other updates, I think we can move on to the next slide. So now we'll hear from our MCPs. So next slide. I don't think Neethi is here today with us from Health Plan of San Joaquin, but if there are any other representatives that were planning to give their updates, welcome you all to share that. If not, we can just move it on to Ileana from HealthNet and then Camille from Kaiser Permanente.
Hearing none. Hi, good morning, good afternoon, everyone. Apologies. Good afternoon. My name is Eliana Argueta, and I'm a regional program manager here at HealthNet. First of all, thank you so much for the new providers, or those providers who it sounds like are establishing some of the CalAIM services in San Joaquin and Stanislaus. I'm going to drop my information in the chat. I know I was messaging you, some of you, as a direct message, but I would love to hear and have an opportunity to get to know you and also provide resources that HealthNet may have as you are establishing your services. And along those lines, what I'm going to be doing here in the chat as well is dropping the information for CalAIM resource for providers. This is a page that's vetted and has been curated to really support our providers, either new providers or providers who are interested in becoming part of our network and learning more about CalAIM and how it's being executed on the lens of HealthNet. We have some great resources such as end-to-end processes. What does it look like when you engage a member, all the way through how do I bill for a service? And we have those end-to-end processes for both ECM and community support services, as well as for doula, community health workers, and street medicine. We also have an array of different trainings that are public and free of charge. There's a set of trainings that happened and are going to continue to happen throughout the end of this year, and they're directly related to behavioral health services and ACEs training. So that's all available there as recordings as well. We've also created these one-pagers that we call authorization guides. And essentially what we've done is we've taken the information from the DHCS policy guide and made an authorization guide for each community support service. As we know, there's 14 of them. And each service has a very specific overview and description of service. So we've tried to ease the reading for our providers and for those who are referring into services by creating these one-pagers. You'll also find our referral forms on our website as well as some additional incentives that as ECM providers and other providers you may be entitled to or eligible to receive as well. So please feel free to reach out to me with any questions related to what you see on our website, any questions about our network, any questions about how to implement services, how do we get you connected and introduced to other providers in the community. There's a lot of great work that we're doing and hopefully leveraging the context that we have, some of the resources that Health Begins is creating as well, such as that directory, to ensure that providers know who the providers are in the community and that they're making those appropriate referrals to really maximize the services that members are eligible for. I'm also going to be dropping in the chat the CalAIM resource for members. So these are public or member-facing documents that really detail the services under enhanced care management. We have a specific flyer for services for children and youth. We also have community supports, doula services, and community health workers. So again, some resources to support everyone on this call with engaging members and also making those appropriate referrals to maximize services. And if anything else, please let me know if we can schedule a call. I'd love to get to know the providers in the community and again, maximizing those connections. So I'm going to drop my information in the chat and please let me know if you have any questions. Thank you so much.
Thank you, Ileana. I think we can pass it on to Camille if there aren't any other questions, and we can move on to the next slide for KP updates. One more. And then I'll pass it to Camille.
Perfect. Thank you, Navneet. Okay, thanks everyone. Appreciate you taking the time to have me, and I'm excited to kind of share a little bit more about Kaiser Permanente Medi-Cal and our network lead entity model. Kaiser utilizes a network lead entity model, and it's a little bit different from other managed care plans to contract with ECM, community supports, and SageW providers. If you go to the next slide, I'm hoping to spend a couple minutes today kind of providing an overview of what the NLE model is, and then some slight changes to our self-referral process. So Kaiser Permanente leverages our network lead entity partners, we also refer to them as NLEs, to support the development of community partner networks for ECM, community supports, and CHW services in all 32 counties. They really help us kind of ensure we have centralized service coordination, really comprehensive network coverage in the 32 counties that we're in, and then collaboration with local community-based partners. And actually I have my chat open, and so I see, Casey, your question there, and I'm happy to answer that now. My understanding, I don't believe that Kaiser is currently open to adding more NLEs. And if you go to the next slide, I can provide an overview of who our current 3 NLEs are. However, the NLEs are still currently open to contracting with additional kind of CBO providers if you're interested in serving KP Medi-Cal members. So currently our 3 community-based providers selected to serve as NLEs are Full Circle Health Network, Independent Living Systems, and Partners in Care Foundation. In Stanislaus and San Joaquin County, currently there's Full Circle Health Network and ILS. Partners in Care currently only serves Southern California. Full Circle Health Network really has expertise in serving children and youth, young adults, and families. So they are contracting with providers that have experience with these populations, and they're really specialized in ensuring that the right folks are serving, children and youth across California. ILS contracts with all 14 community supports providers, ECM providers, and CHW providers across the state in both Northern and Southern California in all of our 32 counties. And so they kind of own our biggest network of community-based providers. And if you're interested in kind of serving KP Medicom members, I would definitely reach out to Full Circle Health Network or ILS, depending on kind of the populations that you serve. If you go to the next slide. So I'm going to spend a minute or so kind of walking through what this means and who engages who. So I'll start on the far right. Community-based providers provide that direct service to our Kaiser Permanente members. They're the folks on the ground kind of building the communities, providing the services. Ultimately, our CBOs are accountable to the NLEs and escalate any kind of concerns as appropriate. They also provide all reporting directly to the NLEs, not to Kaiser Permanente. Our network lead entities, the NLEs, are accountable to KP. They maintain our provider network, do a lot of the gap analysis, hold those relationships with our CBOs. They do a lot of the member outreach and assessments. They provide our Kaiser Permanente team with timely encounter data, and then maintain and provide kind of satisfaction surveys. And then on the far left, there's Kaiser Permanente. Ultimately, we're accountable to the state, to DHCS. We kind of review all the contracting, the quality and operational oversight of the 3 NLEs, and then do all of that kind of eligibility review and disseminate kind of member determination letters. And then we're also kind of the conduit between the NLE lead care managers and KP's care teams. And then go to the next slide. So this should look familiar to most folks here, but medical members have a wide variety of needs. For the lower kind of needs that don't necessarily need a lot of like wraparound intensive in-person care, Kaiser Permanente offers basic population health management and complex care management that's provided within Kaiser Permanente. Everything in purple, so ECM, CHWs, and community supports, are provided through our network lead entities and their kind of community-based provider network. So these are CBOs that exist outside of Kaiser Permanente but serve Kaiser Permanente members. And then on the next slide, I believe it's an overview of the ECM referral process. So for ECM specifically, this is what we're kind of aiming towards in terms of kind of the referral process on the day by day. So day one, it comes in, Kaiser Permanente will accept referrals, no wrong door, from providers, from community members, from families themselves, from folks that call in, from folks that submit another MCP's referral form. Kaiser will accept that. Internally, we assess member eligibility and then share that back with the NLEs. The NLEs do outreach to members to enroll them via multiple modalities. There's a minimum of 2 attempts. And then once the member consents, they begin engagement with their lead care manager for ECM. And then that continues with member outcome measurements kind of ongoing. If you go to the next slide. So I'll spend a minute kind of walking through our referral process and a slight change from probably the last time you might have seen this. So no change around KP's no wrong door approach. We'll accept referrals from literally any source, whether that be members, providers, families, community orgs, anyone will accept that referral. It can be placed via email or phone or through KP Health Connect if someone is seeing their KP provider. What is new is if you are a contracted provider with one of our 3 NLEs and you would like to see that member come back to your organization, you are self-referring to your organization, instead of sending that referral form directly to Kaiser Permanente like we have had in the past, if you want to see that member return to your organization in a self-referral, you would instead send that same referral form directly to your network lead entity that you are contracted with. So that is a slight change. For all other referrals, it would go directly to KP either by phone or through that email for Northern California counties. But if you are an organization already contracted with Kaiser and you want to see that member come back, it would be a direct send to the NLE. So if you go to the next slide, this breaks it down a little bit further. So what this means is if you're contracted with either Full Circle Health, ILS, or Partners in Care, if you happen to be in Southern California, you would reach out to these emails. And I believe that the information is going to be shared after the meeting. I'm also happy to kind of share this afterwards. Feel free to send any questions regarding staff referrals to your contracted NLE or the referral form itself. If you have any issues or have any questions, please feel free to email them and CC this Medi-Cal external engagement email or myself. I'll drop my contact information in the chat after I'm done talking. But if you have any questions about Kaiser Permanente, about Kaiser Permanente Medi-Cal, about potentially contracting with an NLE, or are part of a county agency that needs additional kind of training around CalAIM or ECM or CS, always very happy to connect. I can go, I think we have 1 or 2 more slides after this. Go to the next slide. And so kind of going back to that referral process timing, this is what we're striving towards. There's presumptive eligibility for 2 of the community supports, recuperative care and sobering centers. There's a slightly expedited referral process for short-term hospitalization and post-hospitalization housing, which is around 72 hours. I think the standard authorization for ECM, most community supports and CHW services are 5 days, and then asthma remediation, home modification can be a little longer due to additional kind of paperwork and information that needs to be provided. There are obviously changes coming in the new year around ECM pre-auth that might change a little bit of this. Kaiser Permanente is kind of working on what that looks like to operationalize and more details to come. But ultimately, like, this is what we're kind of aiming towards for the referral process timing. And I think that might be my last slide. I'm happy to take any questions, but I will drop my information in the chat, and feel free to kind of email me if you have something that you'd like to follow up on or would like to connect. I would love that. Thanks so much.
Awesome, thank you. And I will pass it to Melissa.
Any questions though before I move forward? No? Okay, thank you so much, Camille. All right, so we're gonna actually do a presentation from each of the San Joaquin and Stanislaus 211 organizations. So we have representatives from both, and I'll have them introduce themselves shortly. But just wanted to give you all some background as to the purpose of this presentation. So throughout the collaborative over the last year, and even before that, we've heard a really high desire for you guys to build out referral partners and understand local resources within the community. And one of those is actually 211. I'm not sure how familiar you all are with 211, but they are a potential referral partner and also house kind of an internal database of a lot of other resources that you can tap into within your communities. So we'll be hosting a presentation from them today, and then also engaging in a discussion to determine potentially how you guys can connect with them and or update some of your information within their database. So next slide, please. Before we dive into that, we do have some polls here. So the first one is to assess how familiar you are with your local 211. So that can either be the San Joaquin or the Stanislaus 211. So can somebody please pull up that poll, please? Okay, so not at all familiar, slightly familiar, somewhat, moderately, or extremely. And I'll give it like 30 more seconds. So we do have one more poll after this. I'm going to do a 10-second countdown. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay, can we go ahead and share these? I'm seeing slightly familiar. There's some that are not at all familiar, somewhat moderately, so kind of across the board, but slightly familiar is kind of winning here. We're going to go to poll number 2. So do you currently have your services listed in any community databases? And this can include 211. And for those of you who are answering yes, can you put in the chat which community databases you're currently using? Or you can come off mute. Okay, Carrie's on 2-in-1. Unite Us, okay. I'll wait for a couple more respondents. Okay, let's go ahead and close and share. So we have a couple of yeses and then I don't know. There's no no's. So some of you are at least using something. Okay, thank you so much. We are going to go ahead and move forward. I'm going to ask Tamisha and Rigo to introduce themselves, and if we can, thank you so much. And I'll go ahead and hand it over.
Hi, good morning, everybody. I'm Rigoberto Lomas Velasco. I do also just go by Rigo. I'm the Community Resource Manager for the 211 program over here in Stanislaus County through United Way of Stanislaus County.
Hello, everyone, and good afternoon. My name is Tamisha Allen. I'm the 211 Call Center Coordinator for 211 San Joaquin.
Next slide, please.
Yeah, so here just a quick little graphic there for all of you, although it seems like most everybody is pretty familiar with what 211 is. We'll go more into it, but just if you need a graphic in there, I'm sure it'll be shared with everybody after the meeting. If we go to the next slide.
All right, so 211 coverage areas in California. 211 is authorized in 52 counties in California, covering 98.5% of California population. 6 counties representing approximately 5% of California population still lacks 211 services. So our commission is working with various agencies and nonprofit organizations to extend 211 services to those that are unserved. Next slide.
Yeah, again, all that just to show kind of the reach of the 211 program. I know we're mostly focusing on San Joaquin and Stanislaus counties, but for those of you who have programs or services outside those counties, again, 211 is pretty much everywhere nationwide. And as far as for what exactly it is, for those of you that are a little bit less familiar with it, it's an information and resource referrals program that's available 24/7, 365 through the holidays. We're always here serving the community, providing information to anybody who either one calls into, or sorry, getting ahead of myself, that's Tamisha's section, but providing information to anybody who calls in can get pretty much just give us a quick little preview of what or brief description of the situation they might be facing. It could be a case manager as well, who's calling on behalf of a client and saying this is a situation that they're in, or kind of we're looking for this specific service, and we'll provide it to them right there and then. The program also does follow-ups for the most part. And I'll let Tamisha chime in if there's anything specific to her county's program, but we do conduct quality control surveys from time to time. So we will follow up with the clients to make sure that the resources that we provide to them, one, if they were accurate to the needs that they were kind of expressing to us, two, what came of those resources, if they had any issues with it, getting access to them, or if it was just a general success there. And three, depending on who our funders are at the time, we might also have just some follow-up surveys for them for specific populations that we serve throughout the year. And then also 211 is available for disaster case management, disaster resource information. So we do get activated by our respective counties whenever there are the fires, the floods, the nonstop rainstorms that we had last year as well. 211's a pretty good resource. Normally everybody in the county, the counties themselves as well, contact us to let us know these are the shelters that we have. These are the emergency food banks that we're setting up in response to this disaster that's ongoing that just happened. And again, that's where all the critical updates are all being provided to the county.
Yeah, and like Rigo mentioned, we do conduct follow-ups, not only for quality assurance, but here in San Joaquin, I do have 2 care coordinators that work with families that have children 5 or younger, where they provide kind of like case management. They make sure they're connected to the resources for not only their children, but for the parents as well as we are the point of contact for the coordinated entry system for San Joaquin County for housing assistance for those that are experiencing homelessness. So we do have a housing navigator that works closely with the homeless population to make sure they are getting assistance with permanent housing, and then conducting the follow-ups to assist with any referrals to those housing providers that has openings so they can receive permanent housing. Next slide. So 211, easy access to resources. Callers can access live information and referral specialists by dialing 211 and getting connected to the 211 as far as what county they fall in. If they're looking for 211 Stanislaus and they're in a different county, there is a toll-free number, same for San Joaquin County. So they can either dial our 211 number, or there is toll-free numbers for each 211 call center. There's also the national text number, 898-211. They would just input their zip code, and depending on what county that zip code applies to, they'll be connected to that appropriate 211 call center. When callers dial 211, a local exchange carrier routes the call to the authorized 211 provider in the caller's county. From there, the resource specialist will collect demographic information as well as necessary information to best connect them with the appropriate resources. As some of the resources do have certain eligibility, that's why we ask certain assessing questions to make sure that when we're making the referral, that caller is in fact eligible for that particular resource. Resource information can be dictated to the caller, sent to them via text or email. So even if they call in, if they're not able to write down the information, they may be driving or don't have pen and paper, we have the capability of texting or emailing that information to them so they can still get connected to the resources that they're in need of. Next slide.
And again, just kind of going back to the scope of 211, this is the data from the 2023 National 211 database. We do help out millions of people nationwide. For the most part, the services here listed are the ones that are requested regardless of what county the individual is calling from. So again, the biggest areas would be homelessness, access to food, utility assistance, mental health resources, and also just general access to health services, as well as individuals who are unfortunate victims of trafficking or sexual assault. Again, these are kind of the general most requested services, and they're the ones that we make sure that when we're updating our databases, we are connecting with most frequently to make sure that anytime somebody calls in, that they do have access to those resources, that we're not referring individuals to programs or agencies that might have run out of funding, like it does happen often for utility and rental assistance. The next slide, please. And then here are also just the reports for San Joaquin and Stanislaus County, how many calls we get, the individuals that we get calling in, and what services they're looking for. Amisha, I'm not sure if you have anything to add there.
No, you hit the basics on that. And we do these annual reports yearly. They're also available on the 211sj.org website from previous years plus current years. So it is previewed to the public.
We go to the next slide. And then here, we did want to kind of keep this brief just in case any of the ECM providers on the call did have some questions for us. This list here is information that the Health Begins team forwarded over to Tamisha and myself, pretty much saying from the previous conversations, these were the areas that it seemed like the ECM providers wanted a little bit more support in, and wanted to know if 211 was able to support with any of them. Pretty much just going down the list, information and referral hub, we are pretty much just that. It's we make sure that we have the most up-to-date information from our respective counties so that we can refer our clients, so that your case managers can contact us and make sure that they have the information that they need, and that again it's up to date and we're not just referring you to a program just to say that we did, and then lo and behold that program, that agency is no longer running that program or no longer in service. Outreach engagement, both counties, we provide a lot of we conduct a lot of outreach in our respective counties to the community. We let them know not just of the service, but also what services, what information is provided via our programs. We also really want to coordinate with all the ECM providers because it's something that we already do with either our funders or our other community partners that we have ongoing. So really, it's just kind of more so you all telling us what it is that you're looking for, what it is that you all provide, and seeing if we can either provide that already through the services that we have, or I'm sure Tamisha can go into it in more detail, is setting up some sort of an MOU for the specific services that you're requesting. Data collection is also something that we can do. We, as Tamisha mentioned earlier, we do conduct regular reports, quarterly reports, annual reports are all visible on our respective websites. However, if it's something that you would say you want for your specific ECM, the specific number of individuals, demographic of the individuals that we're referring over to you, that's something that we can do, although again, that would kind of fall in line with the us setting up some sort of an MOU, because it's not something that we normally do for our funders. It's more general reports that we conduct there, but we can, if a plan is set up, do specific reports to the individual ECMs or individual partners. And then also strengthening the community networks. I know over here in Stanislaus County, we're working on setting up specific cohorts on some of the more requested services that we mentioned earlier, the utility, the rental assistance, the mental health services, so that we can make sure that we have that up-to-date information. And for one, and then for two, just also making sure that if there is an area where we find ourselves at, we are referring a lot of people to these organizations, but the amount of support that the county is able to provide, the organizations within the county are able to provide. If it's a little bit lacking, then what can we do to fill in those gaps? And I'm sure that's where a lot of the ECM providers would fall in and be able to support us with that. But with that, Tamisha, anything for you to add, or any of the ECM providers, any questions that you might have for us?
Just to mention with the outreach and engagement, if we were to put it together, MOU, and become a partnership, we can also share out particular flyers that you may have, or do certain screenings for our information and referral process to better assess our callers to refer to your particular programs.
I think one question that we have for the group is, how can 211 support you guys? And so I know they've listed a couple of items here, but just kind of curious to hear from the group regarding what type of support you would like to see, if any, was available.
Could I get also for Tamisha and Rigo contact information in the chat?
Yeah, I'll be sure to drop my information in the chat.
I'm just curious too. I have a question. Thank you for that. But I noticed on the graph in the beginning, and you had mentioned that there were, I think you said 6 counties that were not represented by 211. I'm curious because my region is Stanislaus, San Joaquin, but also Tuolumne, Calaveras. Was that lighter color for Tuolumne County, Calaveras? Is that the lacking area too, in Inyo, Mariposa, kind of the rural communities out that way?
Yeah,
Yes.
those. Oh, sorry. Go ahead, Tamisha.
Oh, go ahead.
Yeah, I was going to say that's exactly what that means. Is Tuolumne County unfortunately does not have its own dedicated 211 program. I believe the county does have some sort of a referral program set up in place over there that's not 211 specific. Although I know that they are in talks with some of the other 211 programs in their nearby counties to see if one of them can take on Tuolumne County and provide them the service up there as well.
Is that because you all have you're not available in Tuolumne County, so there are providers that would be available?
So yeah, we're pretty much assigned to our respective counties. Each county has their own 211 program, and it's a different organization. It usually tends to be a United Way organization for the respective county that offers us the program. San Joaquin being one of the exceptions, where it's the Family Resource Center that handles it. Up in Tuolumne, I don't believe that they have their own United Way or a dedicated organization that's able to run that program currently. So that's why they're looking outside of the county to see if any of the other 211s would want to kind of take that on and then begin that database for Tuolumne County residents.
But worst case, there is a natural disaster, and it has anything to do with public safety power shutoff, which is something through PG&E, where if there is a natural disaster that can cause a fire or any sudden wind to where they cut off residents, PG&E, if they receive their electric services through them. 211 San Joaquin does assist with those counties as well as Tuolumne and the rural areas that don't have a 211, more so for emergency assistance. But for just basic resource and referral information, that is something that they're still trying to coordinate and have someone oversee.
Okay, thank you very much, you guys.
You're welcome.
Any additional questions from the group? Okay, let's go to our next poll. So we have this additional poll is how interested would you be in updating or expanding your ECM and CS information in the 211 database? Eliana, go ahead.
Yeah, quick question. I going back to your previous question, I think that I think what I would like to know is how familiar is 211 with ECM and CS services?
Tamisha, are we gonna answer that? I mean, I know I have some background, but if you guys want to. So I can give some context. So we have been in conversations with both Stanislaus and San Joaquin, specifically because this is related to this poll, is we are trying to determine if it makes sense for 211 teams to update their ECM and CS tags within the 211 system. Currently, that is not something that can be searched or accessed through their system. So if you are providing medically tailored meals, it will say that, but it's not going to say that you're an enhanced care management or community supports provider. And so because of that, we've been in conversations behind the scenes to determine if there's interest within this collaborative to get that information updated. So that's the reasoning behind this poll. But as we assess interest, we're also assessing internal capacity within both 211s of San Joaquin and Stanislaus. And from what they've both shared is that they would need to provide their staff with like, here's a 101 of ECM and CS, here's how you would go through assessing a referral and everything. And Rigo and Tamisha, please feel free to add to that because I think that's the bare bones of what you guys have shared with me.
Yeah, Melissa, you pretty much hit it. Like she explained that we have most of the health providers in our database, but they don't directly state, if they're ECM or CS. So that would just be a further discussion and something that we would need to put in place so we can better assist the clients and be able to have our staff more trained and equipped to search those particular providers.
Yeah, and so also another FYI, neither of the 211s are currently contracted with any of the health plans to provide ECM or CS services directly. So they can, at this point, serve as a referral partner, which is why we're kind of trying to assess interest in you guys wanting to update your ECM and CS. And then through the collaborative, we could do some additional support to walk them through the referral process, updating their standards or standard referrals, questionnaires, and or going through their database to add these tags, which, as you can imagine, is an entire process. It's not going to be immediate. And so we want to collectively assess whether there's interest. I know both 211s have expressed interest, but I think part of it is also ensuring that there's some buy-in from the group. Eliana, I hope that kind of answers your question, and also welcome any other additional thoughts or reactions from the group.
Yeah, no, thank you for that context. I think it is helpful. I think it raises other questions for me, and I would love to just be a thought partner if possible. We are contracted with a 211 agency in San Diego, and so that could be a potential, an opportunity for us to learn, based on their experience, like what have they done, right, to kind of implement 211 into the CalAIM services and vice versa. So definitely consider me as a thought partner if needed. But thank you so much for that additional context. It was appreciated.
Absolutely. And San Diego is actually one of the first 211s, I think, that's running with this kind of project, quote unquote. And so we'll probably be hearing from them as well. But just so everyone knows, there is interest from a lot of the other collaboratives for 211s to update their information around ECM and CS and have more of a footprint within CalAIM. And so I'm going to ask the team to pull up this poll so that we can just assess some interest from the group. And I know some of you had mentioned that you're already in 211. We'll have another poll around this, but it would be super helpful to voice over or have you guys unmute whether you have your information in there, if you tagged that you're extremely interested. Would you want to expand your ECM or CS, or do you have those services in there? Does anybody want to unmute and share? Give it.
I don't know if we are in there or not, but I'm gonna find out because I think it sounds like a valuable resource to have for the community. So I'm certainly interested in participating in as far as what ECM and community supports that Master Care represents.
That's awesome. Thank you so much, Lisa. I'm gonna give it maybe 10 more seconds to see if we get a couple more. Okay, let's go ahead and share. So I'm seeing a lot of extreme interest. There's some somewhat and moderately, and then no one said they're not interested at all. So it's really great to see at least some buy-in here. We're gonna go to the next poll. Okay, so this one is, would you be interested in any partnerships with 211 to ensure accurate and timely updates of your ECM and CS services? So as I mentioned, they don't currently tag whether you're an enhanced care management provider or a community supports provider. So this question is more around that, whether you would like to see that. And if we can launch the poll. Thank you. And like I said, this is something that's not going to happen overnight, right? So trying to kind of plant the seeds here and see where there's interest, work with 211, maybe even the managed care plans, and also learn from what San Diego 211 is doing, and determine if this is something that can happen over the next couple of months or something around those lines. I'll give it another second or two. And if not, we can go ahead and share the poll. So moderately interested and extremely interested, again, not really seeing anyone that's saying they're not interested at all. So that's really great to hear. Okay, I'm done with my polls. I'm not going to promise that there isn't any other polls coming up. But thank you guys so much for participating. We really value all of the data contribution that you're giving us here because it does help us determine next steps for the collaborative. So next slide, please. So just some recommended next steps, like Tamisha and Rigo said, that if you want to be involved, each of the San Joaquin and Stanislaus 211s have their own process. They are a little bit similar, but if you want to become a 211 provider, you can review San Joaquin's 211 inclusion and exclusion criteria policy. Stanislaus 211 has one as well. If you're a provider who would like to add your organization or services to the database, there's a couple of online forms that you can fill out for San Joaquin 211, and then there's the forms as well for Stanislaus here. So everyone will have access to these slides, and we'll share the links to that. Next slide, please. Okay, one more poll. I'm so sorry. These are back to back. Before we close out, we do want to ask what section of today's session was most valuable. So we shared some resources. We had some MCP updates on the NLEs and referral pathways. We had the San Joaquin and Stanislaus 211 presentation, and then kind of just our other section. So please go ahead and fill this out. And then Nevni, I think I'm handing it back to you after this.
Yes. We'll give it 30 more seconds. Okay, thank you. Okay, so we can go on to the next slide, which is our next steps. Next slide. So as I shared earlier in the session, we did want to share our upcoming CPI sessions as well as office hours for next year, just so you all can start planning. Also wanted to highlight our tentative dates for our in-person sessions. We are hoping to do in-persons quarterly since we have received lots of good feedback around them. So we will be sending out updated registration links for our CPI sessions and office hours. I know some of our current registration links do tie into 2025, but I will be adjusting that and sending one new link for the session as well as office hours, just so it's more streamlined for everyone. And I know Melissa also put in the chat, if you are interested in hosting an in-person with us, please feel free to connect with us. We would love to host with you. And I think that's it for that. Just wanted to provide a snapshot, and I will be sending more information in an email just so you all can register for those sessions. Next slide. Also wanted to share a quick reminder for office hours. We are going to have office hours this Friday at 10 a.m. And these office hours are open, so please come with any questions that you may have. Topics that we've covered in the past include talking about funding opportunities. I know we talked about cited a little bit at the last office hours. We also talked about the authorization process for housing deposits, engaging with hospitals. So we touch on a variety of different topics, and I know some folks just like to join just to listen in because it is a good learning opportunity. So encourage you all to attend if you're able to make it. And then we're also always open for one-on-ones. If you have specific questions, you're new to CPI, and you would like to connect with us just to learn more, or you have specific questions, please don't hesitate to reach out to me. I have my email on that slide, but I will also just type it in and put it in the chat. Okay, next slide. And then just wanted to share a final reminder. I know we've shared some reminders about this upcoming webinar in our last session as well, but DHCS is hosting a public webinar on December 6th, which is around hospital engagement in CalAIM, supporting connection to ECM services among eligible Medi-Cal members. And the guest speakers will be Dignity Health, UCSF Hospital, and Marshall Medical Center. I know this was a topic that came up during our office hours around how can we best engage with hospitals to support those warm handoffs and referrals. So this would be a great opportunity just to hear some best practices and lesson learned from other providers. And I think we can put that registration link in the chat. If not, it will also be in the slide deck. Next slide. And then just a summary of some next steps. If during our September session you signed up to be a test user of our ECM and Community Supports Guide, we did send a follow-up email last week with a brief questionnaire just to learn about your experience, whether they were helpful. So if you haven't already, we request that you fill that out. And if you have other feedback you want to provide that's not included within the questionnaire, definitely please share that with us. We want to make sure that these guides are as helpful as possible for you all. And then just another reminder around office hours, we can also drop that registration link if you need to register. And then another exciting opportunity that I know Melissa already talked about earlier in the session is we are hosting a CalAIM 101 Learning Lab just to do an overview of ECM and community supports for folks that are newer to this, and we'll have opportunity for Q&A. So if you have staff that are new that you think would benefit from this opportunity, or if you yourself would like to attend, we have that registration link, and we will update the description just to include a little bit more around what to expect. But that will be taking place next Monday at 3 p.m. So look forward to seeing you there if you would like to attend and are able to make it. I think those are everything I had for that slide. And then we can go on to the next slide. Just want to thank you all for coming. Thank you for sharing your insights and feedback. Really appreciate you all jumping in and engaging. And we'll definitely share out the resources that we shared during this session and look forward to seeing you all either at office hours or our last session for the year in December. Thank you.